Okay, we're in Hilchos Milah. We left off at Reish Samech Daled Gimel. That's where we left off. I just want to go back a little bit on what we learned yesterday. So we mentioned, just to clarify, the reason why some of the katan or others are kosher for Milah is because by Milah there's no din of lishma. That's the Gemara in Avodah Zarah, Kav Zayin. We also mentioned, it says that you can use if a baby unfortunately dies before it has a bris milah, it's mentioned that you can use a stone or whatever, any hard reed that you can find. So the two reasons is because, as Rav Moshe points out, that's what's available. Of course, one's allowed to use a knife or a scissor, and there's nothing wrong with that. It's just, that's what's, no, Rav Moshe says, even you can use it. Even though we learned by a child who's alive, we always use a knife, right? That's you're going to get the best results, no splinters. You're not allowed to use a kaneh. So there you're allowed to even use whatever you find. It was in the Shulchan Gavoa that says, in the base of kavaros, you don't always have a knife handy. You just take what you have from the floor and do what you need to do, and it's okay. So that's why it's that difference. But I'll point out an interesting midrash that's mentioned in the Prisha. A stone was always considered to have some level of kedusha, or a purpose for kedusha, like a mizbeach. You build a mizbeach for a korban to Hashem on a stone. So we see that Miriam used a stone. We see that it's Yehoshua used a stone. It says it's sur. On Tzipora. Thank you. I meant right. Tzipora, the wife of Moshe. So when did we mention the word barzel or iron, right, which is in stainless steel? When did we mention using? When did we see iron first being used? So the Midrash says it started with, which is why it's v'davka nice to use barzel, iron or steel, because it's with David HaMelech. When he went to take a stone with the kedusha to kill Goliath, he threw it, and the Midrash says it went basically right through the armor of Goliath, which was made of iron to protect his head. And the miracle happened that the armor became soft and the stone went right through to kill him. So from then on it was zocha to be used for a bris milah. So iron is being used. So that's the preferred. Look at the midrash. It's in the Prisha. Okay. We mentioned not using goyim, not to do a bris on a goy. So there are two reasons. That wasn't so clear. Two main completely different reasons. We mentioned one about it's a chosam from Avraham Avinu. It's our bris. But there's another reason, which is really, again, different opinions. Lahalacha. Tosfos says the reason is because it's done for refuah. And so there, it's an isser to do refuah for an oved avodah zarah, unless he pays you. So then, if you're doing it for money, so based on Tosfos, it's okay. Based on the other reason, it still might not be okay. Anyways, it's discussed. Lamaisa is done, especially because, as we mentioned, the reasons the other day. Something else interesting. It's brought down the Pischei Tshuva, and it's a little bit of Chumash, so I just interesting to mention. Sin Yudalit. But real bekitzer, the Rambam points out that perhaps it's a mitzvah, or I think he says it is a mitzvah, to do it on Bnei Yishmael. So Shagas Ari doesn't exactly agree, because, so what's the source for the Rambam? It's from Bnei Keturah. So they're also from the Zaro Shel Avraham, and they're also Chayav. So Rashi says only those 6 children were Chayav. But the Rambam says no, it's all their descendants are Chayav. And they're mixed in with Bnei Yishmael, and we don't know who was who. So therefore, they all become, because you don't know, they're all Chayav. And so it's a whole discussion. You can see over there, do you go after Rove or not? If it's a Jew, you go after after Rov. If it's a non-Jew, you don't go after Rov. That's one of the tainas of the Nodi of Yehuda. But okay, Ayin Sham point out, because we mentioned it yesterday, and it's going to come up again today. So the question is, two questions. Well, we mentioned about clamps. So I do want to just point out, and as Morty Ness pointed out, shout out to him, that not all clamps, I don't know if I expressed it enough, not all clamps are created equal. One I think that first came out popular was the Gamko, and that was intended to really cut off the circulation completely, so that there's no bleeding. And so the biggest problems that we mentioned was it's going to cause pain, there's going to be no blood. I'm going to talk about that. Blood's an integral part of the Bris Milah. And what was the other thing? Some even say by the time you cut it off, it cut off all the circulation, and the foreskin that's on the other side that you're going to cut off is basically dead. And you're basically not really doing a Bris Milah anymore. The bracha is a bracha levatala, and maybe now the child will be mahul or an aral, but you're lacking the maisa of doing the Bris Milah. So that's another issue. So the Moel Rav Bronstein, it's known as the Bronstein clamp, it's known as the Mogain clamp, and it is quite popular in the secular world or in hospitals. So there is, generally speaking, as long as you don't leave it on for a few minutes. Now, it depends how long you leave it on. I mentioned depends if you squirt in, inject some epinephrine or anesthetic. Is depending if it's just put on real quick, and then you cut and you take it off. There's generally always bleeding. So supposedly maybe there's less pain and there is some bleeding. So basically it's a machokas. Generally it's definitely, the poskim say definitely not, kimat all of them, or all of them say, well, I don't want to start saying, I did not take a survey and I didn't prepare all the who says what, but generally most poskim definitely say not to use it unless it's necessary. Necessary might be a hemophiliac, but nowadays, generally, to deal with that, we just give them the factor, give them an injection of what they're missing. Again, to find out what the situation is, but normally just give an injection, factors, whatever is missing, and that solves the bleeding problem. And then on the 8th day, you can go ahead and give a Bris Milah like normal, again, depending on the situation. So, but that's what one reason. Sometimes if there's not every foreskin is the same. Sometimes there's complicated cases, and you're afraid of bleeding, and dealing with sutures and blood is a mess. So therefore, that can be another reason. Some feel it is okay.
With the Bronstein, is there cutting done?
Yeah, the Bronstein is a clamp. It doesn't. I don't know exactly. I haven't. I don't know if I've seen one personally ever. But it does, what it does is, normally we have the normal shield that we have, that most Moelim use, almost all, was created maybe a few hundred years ago. And it's just, you slide the foreskin right through. There's an opening, there's a slit of maybe a millimeter and change, so you have enough room to slide it through without crushing. And then, right, so the glands, the avers on one side, the foreskin's on the other, and you just slice across and you cut it off. The clamp is basically the exact same thing, but what it does is, after you slide it through, it squeezes, brings the clamp to the shield basically together. It's a little bit of a hinge, and you squeezes it together, and I don't know how much space is in between, but if you do it real quick, then there's always going to be bleeding. And then you cut it. You cut it just like always. There's really no difference between a regular shield and the Bronstein and a clamp, except that the clamp will squeeze together and close in on the skin. Okay, but they're both you cut afterwards. Let's see what else. Okay, so Moshe asked a great question. What happens if you do one uses a clamp and there's no bleeding, especially if you use epinephrine and you leave it on for a few minutes, you do have to do a tafas dam brit. So I'll just point out real quick, again, and we're going to see this. Chazal point out in the Mechilta that Hashem gave two mitzvahs to Bnei Yisrael in the Midbar, right? Dam Pesach and Dam Bris. And it's always been it's always referred to as Dam Pesach and Dam Bris. And it's a drasha on the pasuk. They make a drasha Chazal from Yechezkel Tet Zayin, where it says Ve'avor alayich ve'arech mitboseset bedamayich, and everyone says, the pasuk continues Ve'omer lach bedamayich hayi, Ve'omer lach bedamayich hayi, twice. Why? For those two dam. You see, it's anyways, Chazal point out it's important. Also, there's another pasuk. It says Gam at b'dam britech shilachti arisayich. That's in Zechariah Tet Yud Aleph, where it talks about again the future of Klal Yisrael. Hashem's going to redeem us, bring us back from Galus, based on the schus of the britech, which is the dam britech, the blood of the bris milah. Shabbos Kuf Lamed Zayin says Yomali dam bris lo ditzchaimu shemayim v'aretz. Again, it talks about the dam. And imlo bris on the pasuk, imlo briti yomam v'layla chukos shamayim v'aretz lo samti. Right, the creation is b'schus the dam. All the Rishonim, basically, the Rashi, Ramban, Rashba, Meir, they all talk about dam is an integral part of the mitzvah. Right, it's part of it, and the Ramban and I think others will agree that it's not me'akev one from a bris milah, but it's certainly an important part of it. So that's also, we mentioned, I think, that's an issue, that's a problem with using a laser if there's not going to be any. It's also, it's not the minhag, you're losing the knife, the barzo, v'chule. An important line from Minchas Yitzchak, I don't think anyone argues, but in the Minchas Yitzchak in Lamed Vav, he points out, Lo chosheshim le'eser chovel. We're not worried about chavala or doing any hurting, causing blood, bleeding. Whenever there is, you do it l'shem mitzvah. It's if you're doing it derech bizayon or to hurt someone, so there's an issur deraisa of chavala. But if you're doing it l'shem mitzvah, I don't know if he mentions it, but we know l'shem refuah, we don't call that an issur of chavala.
Yeah, but the question is, do you have to do it? So
you have to do a tafas dam bris. So the only source I saw is the Mishpatei Uziel, first chief rabbi of Sephardic chief rabbi of Israel, he says you have to do a tafas dam bris if there's no bleeding. But I think it's clear from the Shulchan Aruch, from all the poskim, from the case of Nolad Mahul, that I don't think there'd be one who would argue that you have to do a tafas dam bris. It's an integral part of the whole process. We see, even though you're Nolad Mahul or any of these cases, it's done at nighttime. Okay, there's a machlokas we saw if you have to do a tafas dam bris if it was done at night or before the 8th day, but certainly those who do. Anyways, it's goy. We see all these cases where if it wasn't done, if there was no bleeding, it seems to be clear that one would have to do tafas dam bris. But I'll just point out, if you want to, and then time to move on, is the Gemara in Shabbos, I think it's Kuf Lamed Aleph, right around there, maybe Kuf Lamed Hey. There's a machlokas Rav and Shmuel regarding if a baby is born mahul. It's true, it's a machlokas. It's a machlokas in the Gemara basically, and it's a machlokas in the Rishonim how to deal with it. If you know for sure it's mahul and it's 100% perfect, it's true there's an opinion that says you do not have to do a tafas dam bris, just happens to be that's in the Gemara, but the halacha clearly is we do have to do a tafas dam bris. But because of that machlokas, it's not done on Shabbos. So that's because on Shabbos only if it's vadai. So that's okay. So let's read inside with Gimel, and we will start to further understand the process of Milah. Okay. Gimel. Ketzad Malin. How do you do the bris milah? Right? The moel shows up, opens up the baby's diaper, and now is ready to cut. So how do you do it? So Okay, let's read inside. We're going to skip a common step, but let's read inside. Chodchin et ha'orla. We'll come back to it. So the first thing you do in the Shulchan Aruch is you cut the orla, you cut the foreskin. Hachofeh ha'atarah. Whatever covers up, the whole portion that covers up the Atarah. The Atarah can be translated as crown. It's the head, the glans, the end of the whole Aver. Ad shetitkaleh ha'atarah. You have to remove all of the foreskin, and so that when you finish cutting, the Atarah, the whole top portion, is starting from the groove. Maybe I'll show you a picture. We sent it out in the WhatsApp. I don't know what you can see from here. If that helps, closer, farther. So all the way till the bottom, where there is this groove, or it's called the coronal sulcus. I'm sure most of you are familiar. So starting from there, everything till the end has to be completely revealed after you cut it off. V'acharkach porein et hakrum harach shelamata mehaor betziporen, and then there's covering the entire Atarah. Now, I'll just point out right now, there happens to be a machloket. What is considered, now, you're judging, here, this is also a machloket, but we're judging, or what's considered the entire, let me start with this part. We're calling the whole thing, starting from the sulcus and up, which means, in Hebrew, Chazal, it's called a chutas sovev, where it gets a little bit, bulges out a little bit, and then the entire, so that's chutas sovev. Some say that is the Atarah in Chazal. The Beis Yosef says the entire thing is the Atarah, but this is the Ikar Atarah. So there is a little debate on what's the kavan of the Beis Yosef, but let's just assume it means the entire thing is the Atarah. Bechor Shor is quoted for saying only this is the Atarah. I think most poskim say the entire thing is we consider to be the Atarah. And so the whole thing, now how do you judge that? When it's at rest, without an erection. We're going to see for Maras Ayin, that's with an erection, Lakula. Here it's a major machloket, or a big difference. It's a machloket, and it's a big difference if you're judging the foreskin when the Aver is erect, or when it's, relaxed, when it's not. So you obviously, if it's erect, you're going to have less skin to cut, and if it's relaxed, you're going to have more foreskin to cut. So we want to make sure it's entirely revealed when it's not erect. Okay? So the whole thing is going to be revealed. So I'll explain again in a second. Well, maybe I'll explain now. The foreskin, how do we describe? And if you look carefully at my diagram, you'll see that the whole entire foreskin, it's really made up of two layers, but it's like combined. It's like folded over. The whole skin. I don't know if there's a better way to describe it. It's one long, right? It's round. It's the skin, and it's two layers. At the very tip, but it's not two membranes. Look at the diagram, and it's two actual layers, but it's connected at the top, and there's no opening. So what happens is when a moel, right, when you do the circumcision, you're pulling the foreskin away. Let's say some will actually take a pen. They'll find out while the foreskin is there, they'll find out where the sulcus is, while the foreskin, before they even start. Right? The first thing they'll do is you have the foreskin covering the glands completely. They'll look for where this groove is, or a charitz in Hebrew, and they'll mark it with a pen. Okay? And then, so now they'll know how much they have to cut. Then they'll pull the whole thing forward, above, right, because it's able to extend. And then the whole foreskin that comes above, Then they'll put the shield, they'll slide the shield through. So now the pen mark needs to be above the shield, must be above the shield, so that they cut all of it. So if you just do that the way I explained right now, what's actually going to happen is you're going to end up pulling forward all the outer layer of the foreskin and the inner layer of the foreskin, because the foreskin is really made up of 2 layers. And the inner layer will be stuck to the aver, to the glans, and this side. So the inner layer will stay here. The outer layer will get pulled forward, and then when they cut, so everything basically kind of like slings back, or just goes back to its position. So now you're going to see that the entire aver is revealed from one layer, but it's still completely covered, or partially covered, depending on the anatomy, of the inner layer. So then, that's what the Shulchan Aruch is talking about. So first, you pull and cut the or Milah, or the or Orla, whatever you want to call it, the outer layer of the foreskin. And then, there's a whole other thinner, a little more delicate layer, and easier to cut. This, again, you have to be very careful what you're doing, and you need to have good skills or instruments, so that's easiest, especially in those days, to use 8 tziporin. There's, Pi Kabbalah maybe, there's an inyan of the tziporin used to be the klipa, or a makif around us before we sinned, Adam Arishon, before he sinned. So here we are, Ki'ilu, making a tikkun, using the same nail, the same material that was around us before Adam Arishon, when Adam Arishon was born. And now we're removing the klipa that's on before he sinned.
So the inner layer isn't really stretched, it's cut.
Correct. In this case,
it's a dangerous part, it seems, with the knife. You have to be careful.
Well, you don't want to, right, you need to get in there to cut the priya, the or priya, without cutting the aver, or the glans. So I'll explain the probe or the mafreed afterwards. So then what's left? This thin layer, and you don't want to do any damage to what's left, and you have to pry it apart. So you take what's common is you take a sharp nail or a sharp thumb, a nail on your thumb or whatever you use to cut the priya. You rip it with your nail. You grab onto it. You feel it. You grab onto it, and you rip it all the way down to the groove. And if you're doing it with your nail, you're not going to damage. You're right. Your nail is careful and sort of smooth. You're not going to damage the aver. You're going to rip it all the way down, and then you either rip it away and cut it away, or you just fold it down. And then after you fold it down, we're going to see you're going to put a bandage on it, and as long as the whole aver is completely uncovered, whether it's been cut or pulled down, then it's revealed. That's a proper bris milah. And to prevent the skin, whatever gets pushed down from coming back up, is you put a bandage on it. So every mohel is going to, there's also bleeding. So it accomplishes both. A bandage is going to help with the hemostasis, stop the bleeding, and it's going to keep whatever foreskin is there down, and it's going to heal permanently down without growing back. Now that I mentioned that, before you misunderstand me, I do have to point out that there's a famous machlokas between, now the 2 names that are always referred to, it's not just those 2 names, but those are the 2 names that are most famous, who speak most about it, and most passionately about it, is the Chochmas Adam versus the Divrei Chayim. So every mohel needs to know what's the machlokas between the Chochmas Adam and the Divrei Chayim. So the question is, everyone agrees the or a priya, the or priya, you can fold down. Okay? Now, we're going to get to the probe, and we're going to get to cutting both layers of the foreskin at the same time. That might have to be tomorrow. But let me just explain this important distinction. It's that everyone agrees the or priya can be pulled down and healed down. What's the major machlokas famous between the Chochmas Adam and the Divrei Chayim is, what about the or Milah, the orla, the outer layer? So the Divrei Chayim holds Everyone holds you're supposed to try and cut all of it away. That's not a machlokas. And generally speaking, as far as from what I've been told, as long as you have a competent mohel, that always happens. You're always cutting away all of the orla 100%. You grab all of it, you put it through the shield, and especially the shield actually helps to make sure all of it is through. You did what you need to do, and it's not a problem. Again, I don't know firsthand, what happens in every mohel's hands around the world and for hundreds of years. And that's part of the contention between the Chachmas Adam and the Divrei Chaim. It comes out that the Chachmas Adam, you'll see, it puts a question mark, and he himself does put a question mark on a lot of people walking around. The Divrei Chaim says, the way the Divrei Chaim explains, everyone's going to be fine. Because the Divrei Chaim says, as long as you cut part of the skin of the orla, the outer layer, but you didn't cut, let's say you didn't cut enough. So the Divrei Chaim, and we're going to explain that more, what it means to cut enough and not cut enough. But it's, if you don't pull all of it and cut all of it, so it might be a pasal bris milah. But what the Divrei Chaim says is anything that's left, even if it would be a pasal bris milah, you didn't cut enough, it would be tzitzin ha'ma'akvim. As long as you pull it down, right? You pull it down all the way down below, then, and you revealed the entire aver because you pulled it down, that's 100% kosher, no problem. The Chachmas Adam holds, pulling it down is useless. Min Atarah, this is an aral for his entire life. The whole, whatever is considered the skin of the orla, the outer layer, all of it must be removed completely down to the sulcus. It almost comes out even if you have a little bit. We're going to get to what that means next. We'll say that for tomorrow. But as long as you have some of the orla still there, from the orla, and it's ma'akev, pulling it down doesn't help. So at the end of a milah, the mohel is always pulling something down. So as long as it's only or priya, which is the assumption, we wanted to make sure that it's done properly. So then it's an or priya, and then that's okay. But if that's part of the orla that's being pulled down, if it's enough to be ma'akev to prevent a kosher bris, then he says that person is an aral for his entire life. And as far as I know, the only time it's really important, this machlokas, nowadays it's less important, but it used to be really important, is if a baby was born hypospadias, where the whole, right, you have the urethra, the canal, the tube, where one urinates from, and then there's the orifice, the hole, the meatus. That hole sometimes is in a different location. It could be anywhere, anywhere. And it could be down the shaft, down on the gid, anywhere. But anyways, the point is, if it's not in its proper place, we want to correct that with surgery. It used to be, might still be, depending on, consult your surgeon in mohel, if this happens. It happens, I think I read, maybe once every 200-300 babies, I don't know, but it depends what degree. It's common, not so common, but the best way to correct this is using skin. So the best way to correct this is through using the skin of the orla, the outer layer of the orla. So according to the Divrei Chaim, what do? You leave a little bit when you cut it away and pull it down. And then when the surgeon comes later to do the surgery, his skin that he's using to correct the hole and the whole tube or whatever he needs to do is all ready for him to use the best material. But according to the Chachmas Adam, this is, unless it's removed afterwards, this is 100% aral, and you can't say a bracha on the milah. But nowadays there's other methods.